Few people start with the intent of becoming an epidemiologist. Can you describe how your own path brought you to epidemiology?
I came to epidemiology from a need for the information I hoped it was going to supply. I'd been trained in respiratory physiology, which addressed issues of mechanism in lung disease, and realized that causes, background, were not going to be learned from the study of cases. And so it was a need. Early in the 1970s, I was invited by Dr. Corbett MacDonald to join the Department of Epidemiology and set up a lung function laboratory in support of his research into the health effects of, ill health effects of exposure of chrysotile miners and millers in Quebec. This project had been undertaken on the impetus really of the International Commission on Occupational Health, which had identified several important questions that should be addressed, one of which was to determine whether there were gradients in the health effects of the different asbestos fibers.
Mm-hmm.
In Quebec, there was a group of miners and millers exposed very largely, almost primarily, to chrysotile with perhaps some tremolite contamination.
Mm-hmm.
And the opportunity of gathering this data was judged to be important in the contributing to the international
Mm-hmm.
knowledge at the time.
Whom would you regard as the 2 or 3 most important epidemiologists during your lifetime, and on what basis?
I think I would list them as follows: Professor Doll,
Mm-hmm.
Archie Cochrane, Corbett MacDonald, and Rothman.
Mm-hmm.
I have met the first 3 of them,
Mm-hmm.
and Rothman only through reading his book.
Mm. Which do you think has been your most influential paper?
I think my most influential paper has been a paper called Asbestos-Related Diseases of the Lungs and Other Organs,
Mm-hmm.
Their Implications for Clinical Practice. I think that that was important, and it came about like this. When Corbett MacDonald was completing his studies in asbestos miners, they were being reported in epidemiology or public health journals,
Mm-hmm.
and I thought they were extremely important to the practice of medicine
Mm-hmm.
and to clinicians who didn't read those journals, or even if they did read those journals, didn't necessarily see the clinical implications.
Mm-hmm. And the last question is, what would be the single most important piece of advice you could give a new epidemiologist starting their career?
I'd like to quote a graffiti that I read in a London underground.
Mm-hmm.
It said, God is the answer.
Mm-hmm.
And underneath it was somebody written, and we presume it's an epidemiology student, but what is the question?
Mm-hmm.
I think as a student, I would urge you to become involved in what you think are important questions,
Mm-hmm.
in the why of what you're studying, not so much in the how.
Mm-hmm.
The methods can nearly always be worked out, but concentrate on the why
Mm-hmm.
and the importance of the research question.